fearing that they may catch COVID-19. News 18's Marvin Bills joining us now live from Franciscan Health Lafayette East with a look at why doctors say it's a growing trend and a big problem too. Marvin?
Good evening, Jeff, and good evening to you all at home. Doctors told me today that patients have had distant behavior, mainly because of the social distancing guidelines. But they want to stress, while it is important to practice social distancing, so is seeking medical attention that could save your life. Director of the Emergency Department at Franciscan Health Lafayette East, Dr. David Farman, says several people have had emergent medical issues but are choosing to wait before seeking medical treatment.
I think that there's a general concern when people come to the hospital that they're going to be putting themselves at higher risk for being exposed to COVID. In
the last 6 weeks, ER visits at Franciscan Health Lafayette East have dramatically dropped by 50%. Its ER went from seeing 135 to 150 patients a day to only about 60 to 80 patients a day.
In the last 10 days, I've seen the highest glucose numbers on diabetics than I've seen in the last 10 years of my career.
Down the road at IU Health Arnett, doctors are experiencing the same problem.
We started experiencing some decline, and I'm not sure if it was just the scare of COVID-19 versus people just not thinking we were operational in the hospital.
IU Health Arnett's ER visits also dropped nearly 50%. Doctors went from seeing more than 140 patients a day to only about 75 patients a day.
It's concerning.
Dr. Chris Mansfield says their ER had one patient who had an acute heart attack but stayed home for a few days, and another patient who was experiencing stroke-like symptoms but waited to seek help.
I know there's other patients out there that need help from an emergency standpoint, non-COVID patients that I really wish would get cared for.
Both Franciscan Health Lafayette East and IU Health Arnett have designated areas in the hospital to ensure patients are safe and separated.
Safe to come to the hospital. If you're having something, whether it be chest pain or stroke-like symptoms, we don't want you to stay at home and think that staying at home is the right thing to do.
Again, doctors are encouraging those who are having emergent medical issues to leave your home and go to the hospital to seek that medical attention that you need sooner rather than later.